How can I appeal a Medicare Part D drug coverage denial? Imagine you're counting on your Medicare Part D plan to cover a medication you need, and suddenly you're told no. That can be frustrating, but you do have options. When your drug gets denied, it's important to understand why. Common reasons include the drug not being on the plan's formulary, needing prior authorization, or the plan applying quantity limits. Sometimes the drug is in a different tier, which affects your copayment. The first step is to ask your plan for a coverage determination or an exception request. This is a formal way to ask the plan to cover the drug despite the initial denial. Your doctor can help by providing medical reasons why you need this specific medication. You or your doctor can submit this request in writing, by phone, or through the plan's online portal. The plan has 72 hours to respond if it's an urgent request. If they approve, your drug will be covered. If the plan denies your exception request, don't give up. You can file an appeal within 60 days of receiving the denial notice. The appeal process has 5 steps. First is the redetermination by your plan. You or your doctor can submit a written request, call the plan, or use a standard form. If the plan denies this, you can ask for a reconsideration by an independent review organization. This organization is separate from your plan and reviews the case again. If the reconsideration is denied, you can request a hearing before an administrative law judge. This is a formal court-like process. If the judge also denies your appeal, you can ask the Medicare Appeals Council to review the case. This is the final administrative step. If you still disagree and the amount in dispute is high enough, you can request a federal court review. At each stage, you will get a decision letter explaining what to do next. If your appeal is approved at any point, your plan must cover the drug for the rest of the year. It's a good idea to keep copies of all your paperwork and notes on deadlines. Contact your state health insurance assistance program for free help if you need it. Remember, the appeal process is there to help you access the medications you need, even if they are not initially covered. Always work closely with your doctor to gather supporting documents and follow the instructions carefully. Staying organized and proactive can make a big difference in getting your medication covered.